This is the Get Global Young Professionals Talk Global Health podcast, envisioned and created by the Irish Global Health Network and their student outreach team. I am your host, Megan Davis, Communications and Events Intern at the Irish Global Health Network and second-year medical student at the Royal College of Surgeons in Ireland. In this series, join me and my student outreach team co-host Aidan Desjardins, a microbiology student at Trinity College, as we talk to inspiring young professionals leading the charge in their respective fields, often operating in sidelines to their career, following their passions above all.
Today we have a special guest. Welcome to Dr. Sadhbh Lee, who is currently working as an Obstetric and Gynaecology registrar in the National Maternity Hospital. Dr. Lee is very active in the fields of climate change and planetary health. She is a founding member of Not Here, Not Anywhere, a grassroots environmental group, and of Irish Doctors for the Environment, a group founded in 2018 aiming to promote the link between climate change and health.
A warm welcome to our virtual space today, Dr. Lee. Would you mind just giving us some background about how you became a founding member of the Irish Doctors for the Environment?
Sure. Hi guys, thanks a million for having me on today. I guess since I was in kind of my final years in university, I had a really strong interest in environmental issues, and that's originally how I kind of got involved with Not Here, Not Anywhere. Then when I started working, I started really kind of becoming more aware of and more interested in the link between health and environmental change. In 2017, I actually attended a conference that the IGHN held down in Galway on climate change and health. And that really emphasized the message and the urgency of the issue. And at that conference, I met Nick Watts, who works in the Lancet Countdown. And I kind of was talking to him about, how can I, as a junior doctor, kind of get involved in this or do something? And he spoke about how important it was that kind of young doctors were coming together and doing something. So the following year, then a friend of mine reached out to me and said that she was also talking to another young doctor who had just come back from Australia, and she was really impressed with Doctors for the Environment over there. So the three of us came together, and there were two other girls as well. And from that, we kind of just got started with Irish Doctors for the Environment. So it was just sort of a number of different people coming to the same conclusion at the same time. And then we all just happened to kind of get in touch, and it went from there.
No, it's really actually helpful for us to hear the how-to stories of how people take the steps to create new initiatives. So what did you envision the organization to look like? What were your first initiatives?
Well, it was so small at the start. And I think really what we just wanted to do was get together, because all of us had the same sort of sense of urgency and not really knowing where to direct it. So we kind of got together. We just had small meetings at that time. We were reaching out to kind of hospitals that we were working in to see what sort of initiatives we could do there. We were trying to spread the word by doing talks at grand rounds and trying to recruit new members. And, there were a couple of months where it all was kind of falling into place. I guess we didn't probably really have much of a vision at the start in terms of the organization, but more the vision was that we would just really sort of emphasize to people how important the links between climate change or environmental change and health were, and how important it was that we as doctors were doing something about it and getting people involved and speaking about it and kind of teaching both colleagues, patients, and the general public as well about this issue. And then from there, we just kind of grew more in the probably 2019, things really started taking off. We got more members, we got some excellent kind of committee members on board who all really drove different aspects of it. And then it just grew from there. And now we have a formal committee, we have different working groups, and we have kind of heads of each of those. And then we have all of our members as well, who are all really enthusiastic and great. So yeah.
Oh, that's fantastic. Would you explain the interconnectedness between healthcare and environmental health?
Yeah, so I guess there's two sides of this. There, in my opinion, in most of our opinion, health and the environment and environmental change are inextricably linked. There's the One Health kind of model that's been around for a long time, which speaks about this kind of triad that's healthy people, healthy animals, healthy environment. And now this concept of what we call planetary health, which is how human health affects the natural systems that we depend on and vice versa. So the Lancet Commission defined it as the health of human civilization and the state of the natural systems on which it depends. And then there's the Planetary Health Alliance, which is an American-based foundation, which kind of talks about planetary health as a field that focuses on characterizing the human health impacts of human-caused disruptions of Earth's natural system. So it's this real emphasis between humans and the natural world. And sort of how we would look at it is, there's a variety of environmental changes like air pollution, rising temperatures, natural disasters, growing urbanization and loss of green spaces, and loss of biodiversity, all of which we as humans are contributing to, and all of which in turn are impacting our health. So we're seeing sort of rising non-communicable diseases or increasing severity of them. So asthma or lung cancers or heart disease are all linked to air pollution and rising temperatures as well. We're seeing spread of tropical diseases, massive kind of mental health impacts that are associated with biodiversity loss or green space loss, or migration from environmental changes, or people talk about eco-anxiety as well. So all of this is all linked. There's things like, loss of biodiversity has a knock-on effect on medications that we use because a lot of them come from plants. So these are all sort of things that we have to think about. There's maternal health, there's nutrition. It's literally every aspect of health, and every system in the body is affected by the environment and by the changes that we're causing on the environment. So that's how we kind of link them. And then we have kind of a separate but equally as important element is the sustainability of the health system itself and the green footprint or the carbon footprint of the health systems. So there's this statistic from Healthcare Without Harm that if the health sector were a country, it would be the 5th largest emitter on the planet, which is obviously really shocking, but not, when you think about the size of hospitals and the amount of equipment that we're running in them all the time. So we need to also think about, when we talk about healthcare and the planet, we need to think about the impacts of our hospitals in terms of energy use and waste. Obviously, hospitals there are huge amounts of single-use items, especially in the last year, where that everything has been very like gloves and masks, and there's a massive amount of waste produced. There's not always the most efficient recycling system because the priority is always, to be sterile and to keep things kind of as clean as possible. But that does have a knock-on effect. We also have kind of, medication waste, that when drugs go out of date, they're all thrown out, or unnecessary prescribing is another thing. So, people collecting medications that they're not going to take and they're getting thrown out. It's kind of endless, and there's also then, if you're kind of, I know our anesthetic colleagues are really concerned with the sustainability of the gases that are used in anesthesia. It's just, it goes on and on and on. So, sustainability of our hospitals and the concept of green healthcare is hugely important as well. It's something we have to consider.
Thank you. I understand that according to the HSC, we've spent over €1 billion on PPE here in Ireland this past year. So what kind of evidence of this waste and this excess do you see in your day-to-day work in the hospital?
I guess, unless you're kind of working specifically in the waste sectors or in the waste management of the hospital, you don't see it so much. Like, I couldn't tell you kind of how many more bags we're sending out, but you do see, you don't need to be in a hospital. You can walk down the street and you'll see masks on the ground. I fished a mask out of the sea the other day, which was really upsetting for me. And it's just, it's hard to kind of criticize that because obviously COVID has been an exceptional circumstance, a huge stress for everybody and all elements. So the priority kind of shifted during the start of the pandemic, obviously, to making sure that people were safe and that we were reducing transmission. So, we can't kind of get too hung up on that, but I do think that it's just looking at more sustainable and better kind of recycling and waste management in our hospitals.
Of course. I understand that in some regions, like in Malawi, they're starting to shift towards more sustainable options like cloth masks and reusable masks. Is that something you could see that would be viable in an Irish context, or?
I think it all comes down to cost when you're talking about, unfortunately, at the healthcare management system. That's how it works. So if you can work out a way that's going to be equally as effective in terms of reducing infection rates or reducing transmission rates, but is also cost effective, then yes, I guess. But it does take, a lot of the time it takes kind of pressure from the bottom up, because hospital management are extremely busy people. They're focused on kind of, getting things done, and maybe not necessarily always having an environmental focus in mind. But that's kind of the beauty of a group like IDE, like Irish Doctors for the Environment, that we all work in hospitals and we all have kind of this position where we can influence and try to influence what's happening in the hospital. So, going to speak with management about this sort of thing and pointing it out, you'll often find that you get a better reception than you thought you would. So yeah, it's always worth kind of pushing these things.
Yeah. With Irish Doctors for the Environment, it's so good to hear that you were able to develop your passion and then actually change it into action, put it into action rather. So as a young healthcare professional, what are the most important things that we can do to contribute to environmental initiatives?
God, there's so many ways. I think the first thing, especially if you're interested, is just to be aware that, nobody's an expert in this field. Well, most of us aren't. Obviously, we have people at the Lancet, they're experts, but, at our level, we're all working, we're all doing other things, but the most important thing is to have an interest and to have drive. There are loads of resources out there to kind of go and read about it. There's the Planetary Health Alliance website, there's the Lancet, there's papers if you search it, there's resources on our website we can point you towards. So I would always say read a little bit, but don't ever get too stressed about kind of knowing everything. It's such a learning process. We're still kind of all learning every day as we're doing it. I think what's important, especially as whether you're a medical student or you're kind of at the start of your medical career, is looking around you and seeing what is there around you that you can do something about, or what do you see as a problem, because that's the best way to get engaged. If it's something that feels sort of relevant to you, it feels like something you can do. And a lot of the time when we talk about all of this, it's very heavy and it feels very kind of doom and gloom and what can we do, but there's absolutely so much to be done and so much that can happen and can change, and it's really important to always try. So yeah, I think one of the first things that I did when I was getting involved was looked at the hospital I was working in and saw there were no recycling bins in the whole hospital. So that was kind of a project to work on, and you start to learn more from there. You speak to people, you get more kind of information about how these things work. You can look around and see, is there enough bicycle parking where I'm studying or working, and things like that, just to see what you can do. You can also promote it by kind of speaking about this concept. So speaking to friends or other colleagues, or if you're kind of if you're in a hospital, you can try and give a grand rounds talk, all of these things just to promote it and get people engaged, because as a healthcare professional, you have this really valuable platform and people listen to you because you're trusted, the public trust you. And so if you can try and use that platform to advocate for change that is going to benefit your patients or your future patients, then that's a really, really important way of getting involved as well. Something that is kind of a big push more so amongst kind of GPs, so maybe not so relevant for younger healthcare professionals, but is the concept of social prescribing. So instead of kind of leaning towards medication, it's kind of prescribing walks or exercise or spending time in nature for your patients, which is really, really important, for their health, first of all. And also it reduces unnecessary medications. It links people back into the environment. And that's really what you want people to do, is to care about the planet, to care about the environment, because it all links in together, And then, of course, you can always join Irish Doctors for the Environment, because we're always looking for members. We're always happy to have anyone on board. And it's a really supportive network and a brilliant resource. There are people from all aspects of medicine in there with expertise in all various things. So, there's always someone who will have an answer to a question or can point you in the right direction.
What sort of skills are you looking for with the Irish Doctors for the Environment?
Well, nothing particular. I mean, everybody is welcome. You don't have to, you can feel like you have no skills, or you can feel like you have loads of skills. Everyone is welcome on board. We're still kind of a relatively new organization, but anything is welcome. We probably could do with some IT skills always, but we're managing on that side somehow.
Did you find that as a doctor that you have actual influence at the management level?
You can, yeah. It can be tricky, and it depends on the management and the hospital and how willing they are. But yeah, it's definitely, people are, I think the organization as a whole, when people hear about it, they're quite excited about it. So I found approaching them on your own as just an individual is trickier. But when you're going and you're a part of this group and you can point to the group and what they've done and what we've done, and kind of you have that sort of a backing behind you, that can make people more willing to kind of link in. And certainly we've been approached by hospital management looking for kind of advice and input on how to kind of make the hospital greener and things like that. So yeah, definitely. I know sometimes you feel like, because we change over a lot, and the longevity is something that can be a little bit tricky, but we have a kind of a green healthcare network now that's being set up so that green committees in various hospitals throughout the country are linked in together. And what's really good as well is if you have a consultant in the hospital who can kind of get involved, because they're not going to change in July when you have to go. So it's good to have some sort of continuity there from that aspect.
You mentioned a green healthcare network there, and I understand you guys also have a number of resources on your website, but are you able to share any upcoming initiatives or developments that we should be aware of that you're involved in?
Yeah, well, there's lots of different working groups within IDE. So we have sort of, no matter what element you're interested in, there's nearly going to be something you can direct it in. So there's an active transport one, which are doing a lot of work on kind of lobbying for cycle lanes and public transport around Dublin, and in Galway and in other cities as well. We have an air pollution group. We have one for sustainable diets. The one that I'm the most involved with is one that's, and actually probably one that's quite relevant for young healthcare professionals, is one looking at teaching on the medical curriculum about the concept of planetary health. So we're working with kind of all the universities around Ireland to develop proposed curriculum that's going to incorporate elements of planetary health, and then looking at how we're going to go about actually implementing that into the curriculum. So we have this kind of something called the CHIME network. It's Climate and Health in Medical Education Ireland. And with that, we actually have a student group that is doing a lot of work on kind of assessing the current teaching on planetary health in the universities. And they will link in with us when we're kind of looking at this curriculum. So that's a really exciting kind of development, I think. And again, that's always something that people are more than welcome to get involved in if they're interested in that sort of thing.
That's fantastic. It sounds like an amazing effort. If someone were to get involved in that, would we contact you through the website, or is there some sort of resource to get a hold of people involved?
Yeah, the website, you can link in there. We have a membership form that you can sign up via that. Yeah.
Oh, perfect. And on the education side, do you foresee the incorporation in a larger sense into the curriculum, like its own module for planetary health and climate change, seeing that it's increasingly becoming more important?
Yeah, I mean, the ideal, the dream is that it wouldn't have to have its own module, but in fact that it would be incorporated into every element of teaching, because, going back to what I was saying earlier, it affects all of the systems. So we would love to have the cardiology teaching incorporated and the RESP teaching, but that's quite a big undertaking. So at the moment, we're kind of focusing mainly on working with the public health, lecturing in the public health departments, and looking at whether or not we'll incorporate it as a module in 1 year, or will we be able to kind of spread it out over the different years. It's probably going to be university dependent. So at the moment, we're just focusing on the kind of what we think should be involved and kind of giving a suggestion and see where we go with that. Yeah.
Great, thank you.
Thank you so much, Dr. Lee, for joining us today and sharing your passion for environmental health. For more information about Irish Doctors for the Environment, you can visit www.ide.ie or find them on Twitter with the handle @IrishDocsENV. On Spotify, you can listen to their new podcast titled Conversations with Irish Doctors for the Environment. Many thanks for listening, and join us again for Get Global, Young Professionals Talk Global Health.